Does age impact running biomechanics in athletes? Have you ever wondered how age affects the way athletes run? It's a fascinating topic that touches on biomechanics, especially for those involved in track and field, sprinting, and marathon training. Let's break it down. As athletes age, their running biomechanics do change. This means the way they move and the forces at play during running can be influenced by age. One of the first things to note is that muscle strength tends to decline with age. This is particularly true for the muscles in the lower body, like the hip abductors and knee extensors. When muscle strength decreases, it can lead to changes in how power is generated during running. Another important factor is the range of motion in joints. Older runners often experience reduced movement, especially in the ankle and knee joints. This limited range can affect how long their strides are and how fast they can run. When the joints do not move as freely, it can lead to shorter strides and slower speeds. Ground reaction forces are also impacted by age. These forces help propel the body forward while running. As people get older, these forces tend to decrease, which can be linked to the loss of muscle strength and stiffness in tendons. Stride characteristics change as well. Older runners generally show a decrease in both stride length and running speed. This is primarily due to the reduced power produced at the ankle during the stance phase of running. Interestingly, while there are natural asymmetries in how limbs move, these do not necessarily worsen with sex. Differences also play a role in running biomechanics. For instance, female runners may face additional changes due to hormonal shifts, especially around menopause. These changes can affect muscle strength and joint function differently than in male runners. So, what does this mean for training? Older athletes should focus on maintaining or improving lower limb muscle strength. Targeting the hip and ankle muscles can help preserve running mechanics and performance. Adjusting running speed and stride mechanics can also accommodate age-related changes while reducing the risk of injury. Strength and conditioning exercises that focus on developing power can counteract declines in joint power and propulsive forces. For sprinters, it is essential to maintain explosive power and joint mobility. Marathon runners, on the other hand, may benefit from endurance-focused strength training to keep their running economy intact. Understanding that some changes in biomechanics are a natural part of aging can help athletes and coaches set realistic goals. By adapting training strategies to address these shifts, athletes can maintain performance and minimize injury risks.